Good morning. Thank you all for joining us this morning. Since the pandemic, Central Florida community has seen an alarming increase in overdose deaths. Those deaths are largely attributed to the use of fentanyl. In an effort to address this epidemic, I've established a narcotics unit within my office that will streamline the prosecution of these cases. We are committed to targeting and dismantling major drug trafficking organizations and offering alternatives to incarceration for those who are exploited by those organizations. For decades, we've tried to incarcerate our way out of the drug crisis. It failed in the 80s and in the 90s, and it won't work now. The state of Florida incarcerates more people than the national average, with prison populations of over 96,000 incarcerated people. Of this number, an overwhelming number of those people are incarcerated for drug offenses. This costs the taxpayers nearly $3 billion a year. History has taught us that we cannot use broad strokes to address this drug epidemic. Some people will go to prison. However, incarceration alone has not and cannot be the only solution. Targeted prosecution resulting in the incarceration of violent drug offenders and those seeking to capitalize off of those suffering or who are addicted. In addition to alternatives to incarceration, differentiating those who suffer from addiction are both essential components of an effective strategy to end this epidemic and save lives. This commitment requires a concentrated effort to produce consistent outcomes and regular review to ensure that our approach remains effective, grounded in data, and consistent with the mission of this office. Over the last several months, I received letters from Chief Odell with Kissimmee Police Department, Chief Gauntlet with the St. Cloud Police Department, and Director Massey with the Florida Department of Law Enforcement Office, withdrawing their agencies from the Osceola County Investigative Bureau, also known as OCIB. They've indicated that they lost confidence in the leadership and operation of OCIB and did not wish to continue their involvement. Last Monday, I, along with the remaining board members, voted to dissolve OCIB. Despite the dissolution of OCIB, we all remain committed to working collaboratively, relying on our collective experience and leadership to ensure that drug cases are thoroughly and properly investigated and prosecuted in this circuit. We understand that no one agency or entity can address this problem independently, but that we must all work together collectively for the good of our community. I also look forward to continuing this mission with all of the agencies who are and will become a part of the Metropolitan Bureau of Investigation. We will strategically address this crisis by fostering trust and have legitimacy in the communities we serve, investing in community-based prevention and intervention programs, setting strategic enforcement priorities, measuring our results and our efforts, narcotics training, and of course, partnership with law enforcement. And now I would like to provide an opportunity for our agency partners to speak. I'll invite Chief Odell to make remarks.
Good morning. Thank you, Ms. Worrell. We are, I guess the message that I want to send is we are committed to drug enforcement and keeping our city and streets safe. We have elected to withdraw from the task force that's been in place down here, and we're a part of that decision. It just didn't feel like we had the experience necessary at the command level. MBI. I'm used to working with them from my previous time with the Orlando Police Department, and they've got decades of experience that's been passed down, especially and specifically at the supervisory and command level. So I think it's important for us, and I've applied for the Kissimmee Police Department to be a member of that task force. But I appreciate the state attorney's commitment to identifying a group of prosecutors that will handle drug trafficking cases, and I think it's critical for us to have that smaller group to then have kind of a laser focus on those plaguing our communities with drug sales, violence, and everything associated with that. So thank you.
At this time, I'll allow for any questions that there might be. If you would raise your hand, I'll call upon you. State your name and the media outlet that you represent, and I'll allow everyone to ask at least one question to begin. Yes, Ms. Thomas.
So I wanted to find out, are you already, what's the current numbers in terms of the cases that you're seeing between Orange and Osceola counties with the fentanyl?
So I saw a report recently reported by the Orlando Sentinel that said that there were some 250 overdose deaths this year compared to a lower 200 number that happened last year. So we're seeing that increase, and that is alarming, and that's why since I started in January, we wanted to build a narcotics unit, but have had many other priorities, and now we're finally devoting the resources to being able to address that so that we can save lives.
On that Orlando Sentinel, can you say which are all the agencies participating?
Participating in what?
In the narcotics unit.
So the narcotics unit is internal within the office of the state attorney, and that is going to be selected assistant state attorneys who will review narcotics cases, specifically trafficking cases. And the reason that we're doing this is so that we can have consistency and efficiencies in the way these cases are resolved. What we have now is that these cases are handled at large by all of the attorneys who are handling felony cases, and we've seen a lack of consistency in how these cases are resolved. By concentrating these cases within our narcotics unit, we'll be able to have one individual who's familiar with who are the most dangerous drug traffickers out there, and how can we target those individuals to incapacitate those organizations. Welcome.
Can you talk about collaboration with law enforcement? Today, the Osceola County Sheriff's Office announced the formation of Narcotics Unit with their agency. Why aren't they here today working with you?
They were invited. I can't speak to why they're not present.
Lauren with Channel 9. What is your message to the drug traffickers who have basically been out there working all this time?
Thank you for asking that. We will not tolerate these organizations overtaking our communities. We are going to be targeting these individuals and dismantling these drug organizations for the betterment of our community. We don't want to see one more overdose death in our communities, and we will work very hard to ensure that we bring those individuals down.
And just a follow-up, you say you're basically both addressing both the law enforcement and the medical side, I guess you could say. Can you expand on that? Basically, the approach is basically both to preventing the overdose deaths, but at the same time holding those traffickers accountable.
Yes, and again, thank you for that question, because it's very important to understand that we cannot use broad strokes. We can't treat everyone the same. And I believe that that is where for decades we have failed our citizens, because we've treated everyone the same. And we have to understand that there are suppliers, but there are also individuals who are addicted. And we're not doing anything to end drugs in our communities by putting away individuals who are suffering from addiction for decades. We're not doing anything. If that would have worked, then the war on drugs in the 80s and the 90s would have been successful, and we wouldn't be standing here talking about this today. But the reality is, when we send individuals to prison who are addicts, they continue to be addicts. And because of the experiences in prison, their addiction gets worse. There are drugs in prison. So we are fooling ourselves if we believe that by sending addicted people to prison that we're doing anything to make our community safer or better. Part of my unit's responsibility will be differentiating those individuals. And we will not be using broad strokes to handle every person brought into our office on drug cases.
Following up with the medical side of things, are you in touch or aware of the supply of Narcan to kind of prevent some of the effects of that? So you guys have discussions about that?
No, and that's going to be more on the law enforcement end of it. And it's a really good point to know that law enforcement has their role in this. They are investigating and they are making arrests for drug cases. The state attorney's role is very different. We are looking at the big picture. We're looking at criminal histories to identify which individuals have histories that would show that they are more likely on the addicted or exploited side than they are on the side of those who are doing the exploiting. And in doing that, that's how we'll make determinations as to what is the best resolution for these cases. But Chief Odell, would you like to speak to the use of Narcan and how that may or may not have impacted the overdose deaths?
Not prepared to give you the numbers exactly this morning, but I can tell you that all the law enforcement agencies in Osceola County are big proponents of utilizing the Narcan. We've trained all of our officers and deputies, and the percentage of usage is up each year that Narcan's been available to us, and we, fortunately have saved countless lives with the use of Narcan. So, although, we're saving lives, we would like to, if we could eradicate the drugs being available, then that would be the preference.
I want to shift gears to the latest relevant case suspended in your office for 1 week.
I'm not going to comment on that at this time.
How about the Marquis Floyd case?
That case is not being handled by my office, so I'm not going to comment on that either. All right, thank you all very much for coming.